This past March, amidst an ongoing budget crisis in Albany, we faced a crisis of our own here in Brooklyn. At risk was our most vulnerable population, those in need of quality health care, whose Brooklyn healthcare system was failing not only the people of my district, but the entire borough of Brooklyn. Immediately, I met with the Department of Health to discuss what had to be done to ensure the people of Brooklyn received vital services and the quality of care that they needed. I enlisted one of Brooklyn's most powerful and notable advocates, and that was the borough president, who was represented, Borough President Marty Markowitz, who was represented by the Deputy Borough President Yvonne Graham, who will speak, to join me in creating Brooklyn Healthcare Working Group, a coalition of healthcare providers, administrators, advocates, and stakeholders to take a hard and honest look at the direction in which Brooklyn's healthcare system was heading and how we collectively right the way. Under the direction of the Deputy Borough President Graham, we held 2 healthcare summits at Borough Hall where an unprecedented show of solidarity existed. We had CEOs from different hospitals working in the same group as community-based organizers, nurses, doctors, and administrators to restore the credibility of the Brooklyn Healthcare Network by brainstorming for new strategies to address an ailing system. When it comes to people's health and well-being, there needs to be a strong infrastructure capable of providing care to more than 2.5 million residents of Kings County, and that's Brooklyn. The top priorities we have identified in addressing the issues of Brooklyn ailing system, there are 3 top priorities. The first one is increase the capacity of our primary care infrastructure. Brooklyn residents needs to visit doctors, not emergency rooms for primary care. The second point is we need to formulate an active, coordinated care model to streamline collaboration and partnership between providers across Brooklyn. And the final one, we need to ensure that community-based organizations, which offer wellness resources to Brooklyn residents, are strategically integrated into our healthcare network as well as engaged in the community. We have to have all dynamics working together in order for us to reshape the infrastructure that presently exists. If we properly implement, we believe that these recommendations, which they are only recommendations, will help alleviate some of the long-standing issues that the Brooklyn healthcare system has. In Brooklyn, our hospital is seen as community institutions, and as just one hospital fails, there will be a ripple effect, a domino effect, fell across the entire borough, which may take years, and I mean years, and maybe millions, maybe billions of dollars to correct. We as individuals, as healthcare providers, as institutions, elected officials decided to come together to understand how important it is that there needs to be a solution. We can't have organizations who don't know much about our community and much about our healthcare system here in Brooklyn make certain recommendations. We need to be proactive instead of sitting back and being reactive, as Viola would always say. You know that? So we are in a very proactive move, making sure these recommendations will be heard, and we believe that the Burger or the redesign team will take these recommendations and hopefully help us create a system and change the system that presently exists. At this point in time, I want to welcome to the podium the Deputy Borough President, Yvonne Graham, and later on I will thank all those who were involved in this working group, ladies and gentlemen. Thank you very much, Deputy Borough President.